Hi, I'm going to talk to you today about vision correction options, specifically laser vision correction. One of my favorite parts of my job is getting to watch patients' lives be transformed by these vision correction surgeries, and I'm very excited that you're considering surgery. We do have two options that we're going to talk about today. SMILE, which is a small incision laser correction procedure, and then LASIK, which is the more traditional method of vision correction. Let's start by talking about SMILE. SMILE is the small incision procedure. This small incision has three benefits over the traditional method of surgery. Patients tend to experience less dry eye after the procedure. The cornea retains more of its normal strength or structure, and then the rate of swelling or issues that can arise in the healing period is significantly minimized. The procedure is very fast, taking no more than 20 minutes. It's done just down the hall in our operating room. Prior to surgery, patients can take a mild sedative to help them relax during the surgery, and then it's all done with eye drops that numb the eye so it's completely comfortable. During the surgery, patients lie flat on their back on the surgery bed. A laser is used to create a small disc-like shape in the cornea, like a small contact lens. It's then removed through the small incision, which permanently changes the shape of the eye, correcting the vision. The night of surgery, it's normal to have a little bit of redness. The eyes may sting a little bit, and the vision will be a little bit cloudy the first day. The next morning, most patients experience about a 60 to 70% recovery. The vision generally is acceptable for most activities like work or driving. There will be a little bit of a delay for the final clarity and crispness to be realized. However, most patients experience significant improvements even in 3 to 5 days. Most people, once again, are able to resume normal activities right after the day after their surgery. Eye drops are necessary for 1 week, and you'll get written directions for those. There are 3 different eye drops that just help the eye heal up in the healthiest manner. Patients can resume most normal activities the day following the surgery. There are some things that will need to be avoided, however. It is important not to rub the eyes for the first 3 days, so we'll provide you some protective goggles or covers to wear at night when you're sleeping. We also provide you glasses to use when you're showering to help reduce the likelihood of getting water in the eyes, because it is very important to avoid water exposure during the first 3 days. Eye makeup needs to be avoided for the first week, and then swimming pools and hot tubs need to be avoided for 2 weeks. This will all be gone over with you again, and you'll get written directions for these instructions. SMILE does have some side effects. The number one side effect of surgery is temporary dry eye. So the eyes do tend to be dry for up to 3 to 6 months after surgery. To help with this, we'll recommend the use of some over-the-counter eye drops called artificial tears that will help keep the eyes comfortable and keep the vision clear. We also offer some in-office procedures that are recommended. Prior to the surgery, we do recommend a 2-step process. It's a procedure designed to help the eyes produce healthier tears and higher quality tears. Step 1 is a gentle cleaning of the eyelids and eyelashes to remove any bacteria that can build up there. It's a gentle procedure that takes about 15 minutes. Step 2 is a warming and massage of the glands in the eyelids that help produce the oil in our tears. By getting these flowing better and moving better, it helps the eyes produce naturally healthy tears, and the benefits of this procedure can last for several years. In addition, during the surgery or after the surgery, we can place small tear drain blockers in the area where tears drain from the eye. They're called punctal plugs. By placing those there, they last about 3 months. They're temporary. They do help keep more of the body's own natural moisture on the eye surface, promoting the best comfort and clarity of the vision and health of the eyes for 3 months. The second side effect of surgery is some glare and halo around lights. They tend to last for about 1 to 3 months during the healing period. Most patients have a full resolution of those after that time. There is a small chance of swelling that could be associated with the surgery. Things like cells could grow into the very small incision, or there could be a small area of inflammation. Now, this is very uncommon. With the SMILE procedure in our office, we're looking at less than 1 in 400. Should this occur, additional eye drops or very, very rarely another surgical procedure could be necessary. Finally, the SMILE procedure does offer permanent vision correction. However, there can be some things that could interfere with that. The first of which is something that we call underhealing. Underhealing means you don't quite heal as anticipated, meaning that there is some leftover prescription that's not fully corrected after the surgery. Should that occur, a small portion of patients may need a second procedure called an enhancement to help adjust for this. Finally, there's something called regression. Regression means that over time, the vision can drift or shift. Your prescription would never be as high as it is currently, but should that happen, an enhancement is an option. We do offer enhancement coverage for certain periods after the surgery. So SMILE is an exciting, safe option that's done through a small incision. The alternative that you have is the LASIK. LASIK is the traditional method of vision correction. With LASIK, our surgeon uses a laser to create a flap on the front surface of the eye. The surgeon then lifts the flap and uses a separate laser to apply a corrective treatment. During this, you will hear a buzzing noise and you may smell a faint burning smell. Both of these are normal. After surgery, just like SMILE, the day of, your eyes probably will be a little bit red, they may sting a little bit, and the vision tends to be a little bit blurry. The next day, patients have about 80 to 90% recovery. One advantage of LASIK for this is that the vision does tend to recover a little bit faster. All the swelling gets to sneak out through the large edges of the flap, versus with SMILE, it has to come out through the very small incision. So the recovery is a little bit faster. However, with either surgery, most patients can resume most normal activities the day after. Eye drops are identical to SMILE. They're used for 1 week. The things that need to be avoided are the same, including no water in the eyes or rubbing the eyes for 3 days, no eye makeup for 1 week, and no swimming pools or hot tubs for 2 weeks. And side effects are also the same. Dry eye does tend to occur with LASIK and lasts for 3 to 6 months. We do recommend that ocular surface package, the 2-step procedure that includes cleaning the eyelids and eyelashes, and then a warming and massage of the glands in the eyelids to help the eyes produce more oil and healthier tears, and then the punto plugs to help reduce that. The second side effect, like SMILE, is the glare and halo around lights that tend to last about 1 to 3 months. They do tend to be temporary. There is a small chance of swelling that could occur. There could be some cells that could grow underneath the flap, area of inflammation that could occur. The likelihood of these is also very low. They're uncommon, but with LASIK are about 1 in 100. Should this occur, additional eye drops or another procedure could be necessary. Finally, an enhancement could be necessary for the best results should you experience what's referred to as underhealing or regression, which would be the short-term need for an enhancement if the vision is not as sharp as anticipated, or the long-term drift that could occur over time. Finally, it is important to note that for these procedures, if someone is over the age of 40, there is a process that occurs at that time called presbyopia. Presbyopia is the loss of the near focusing ability, and if you do have surgery with LASIK or SMILE and the vision is corrected for far, you will need to wear reading glasses. The only alternative to this is if the vision is corrected one eye for distance and one eye for close. This is something called monovision and can reduce the likelihood of needing the reading glasses. It is important to note that surgery does not create this issue. You just have to deal with it a different way. So if you were not to have surgery, then bifocal glasses or bifocal contact lenses are necessary after the age of 40. Once again, LASIK and SMILE are both very good vision correction options with the goal of permanently correcting the vision and adjusting it for the long term. They're both very safe procedures, and once again, some of my happiest patients are those that are undergoing these procedures. I'm very happy that you're considering having it with our office.
Your eyes and your vision are priceless. Your vision allows you to see the things you love, to create lasting memories, and enjoy your favorite hobbies and interests. Today, an exciting laser technology is available to help improve your vision and offer increased visual freedom. It's called SMILE, and it promises to offer precise vision to thousands of people. We want to show you how SMILE can benefit your vision for years to come. In a SMILE procedure, innovative laser technology is used to gently create a thin, contact lens-shaped layer just beneath the surface of your eye. The layer is removed through a tiny opening, also created by the laser. There are many things to love about the SMILE procedure. From start to finish, the entire procedure takes just minutes, and the SMILE laser does its job in about 30 seconds. Most patients describe their SMILE experience as comfortable and gentle throughout the entire procedure. As a result of the SMILE procedure, your cornea is gently reshaped, which helps your eye create a more focused image. This precise vision outcome may reduce or eliminate your need for glasses and contacts. SMILE is a proven laser vision correction procedure that has offered improved vision for hundreds of thousands of people worldwide. Visual freedom is available to you with SMILE. It's a gentle, proven, quick, and effective laser vision correction procedure.